Welcome, everyone. I'm excited to kick off today's presentation on mental, behavioral, and neurodevelopmental disorders. This is the first of 6 slides, and I'll be guiding you through some important insights and information. We'll explore what these disorders are, how they affect individuals, and why understanding them is so crucial. So let's get started. Let's take a closer look at the guidelines for coding pain disorders related to psychological factors. When the pain is exclusively linked to psychological disorders, we assign code F4541. It's important to remember that, according to the excludes one note under category G89, we should not assign a code from G89 along with F4541. On the other hand, if the pain disorder involves psychological factors but isn't exclusively related, we use code F4542. In this case, we should pair it with a code from category G89, which covers pain not elsewhere classified. Now, shifting to mental and behavioral disorders due to psychoactive substance use, when selecting codes for these conditions, especially for categories F10 through F19, it's crucial to consider the concept of remission. If a provider documents a disorder as being in remission, we need to rely on their clinical judgment to assign the appropriate code, specifically those with the suffixes -.11, -.21, or. Ultimately, accurate coding depends on careful interpretation of the provider's documentation and understanding these specific guidelines, which help ensure our coding is precise and consistent within the overall framework of psychiatric and pain disorder classification. When documenting psychoactive substance use, abuse, and dependence, it's important to understand how to assign the correct codes. If the provider notes use, abuse, or dependence on the same substance, we only assign one code, following a specific hierarchy. First, if both use and abuse are documented, we assign the code for abuse. Next, if both abuse and dependence are documented, we choose the code for dependence. And finally, if all three, use, abuse, and dependence, are documented, we still assign only the code for dependence. This hierarchy helps ensure consistency and accuracy in coding. Moving on to the next point, when the diagnosis is unspecified for psychoactive substance use, we use the codes marked as unspecified, like F10.9, F11.9, F12.9, and so on. These codes are used when the specific substance or pattern of use isn't clearly identified, which is common in cases where the documentation isn't detailed enough. Remember, using the correct unspecified codes helps us maintain clarity and precision in our records, aligning with the overall goal of accurate diagnosis and treatment planning. When we talk about medical conditions caused by psychoactive substance use, abuse, and dependence, it's important to understand that these conditions are not classified as substance-induced disorders. Instead, they are considered separate medical issues that may arise due to substance use. When assigning diagnosis codes for these conditions, you need to follow the guidance provided in the alphabetical index. This means selecting the appropriate code for the medical condition itself, and then pairing it with the correct code that reflects the specific psychoactive substance involved, whether it's use, abuse, or dependence. For example, if someone develops alcoholic pancreatitis due to alcohol dependence, you would assign the code from subcategory K8052, which stands for alcohol-induced acute pancreatitis. Alongside that, you also assign the code from subcategory F102, which pertains to alcohol dependence. Specifically, in uncomplicated cases, you would use code F1020. The key point here is that the medical condition and the substance dependence are coded separately but linked, ensuring a comprehensive understanding of the patient's health status. This approach helps in accurately capturing the clinical picture and guiding appropriate treatment. So, in summary, always follow the coding guidelines carefully, assign the correct codes based on the clinical scenario, and remember that these medical conditions, although related to substance use, are distinct from substance-induced disorders. This ensures clarity and precision in diagnosis and treatment planning. Let's talk about the blood alcohol level code, which is categorized as Y90. This code is used when there's evidence of alcohol involvement, and it's determined specifically by the blood alcohol level. Now, for this code to be assigned, certain conditions need to be met. First, the blood alcohol level must be documented in the patient's records. Second, the healthcare provider must have recorded a condition that falls under the category of F10, which covers alcohol-related disorders. So essentially, if a patient's blood alcohol level indicates alcohol involvement, and there's a documented alcohol-related disorder, this code helps us accurately reflect that in their medical record. This is important because it ensures that we're capturing the full picture of the patient's condition, especially in cases involving alcohol, which can significantly impact treatment and outcomes. By understanding this coding, we make sure that the documentation aligns with the clinical findings, supporting better communication among healthcare providers and accurate data collection for analysis and reporting. Now, let's look at factitious disorder. When someone imposes this disorder on themselves, it means they are intentionally fabricating or causing their own physical or psychological symptoms. It's a way of seeking attention or care, even though there's no actual medical condition causing these signs. On the other hand, factitious disorder can also be imposed on another person, which is often referred to as Munchausen syndrome by proxy. In this case, the person causing harm or fabricating symptoms is the perpetrator, not the victim. When diagnosing this, we assign the code F68A to the perpetrator's record. For the actual victim, especially if they are suffering from something like Munchausen by proxy or medical child abuse, we assign the appropriate code from the T74 categories, which cover different types of maltreatment. Now, moving on to dementia. The ICD-10-CM classifies dementia based on its cause and severity. The categories include F01, F02, and F03, which help us specify whether the dementia is due to vascular issues, other specified causes, or unspecified causes. Additionally, severity levels are recognized, whether it's mild, moderate, or severe. This classification is crucial because it guides treatment planning and helps us understand the impact on the patient's functioning. Overall, understanding these distinctions helps us better identify, diagnose, and manage these complex conditions, which are essential parts of our broader focus on mental health and patient safety.